morning, Lake Providence Church family and friends. This is Dr. Linda Plummer Ward. Thank you so much for joining us for another health ministry update. We're going to focus on the J&J vaccine update. So the CDC and the FDA lifted the pause to check for safety of the J&J COVID-19 vaccine on Friday, April 23rd. The two organizations feel confident that the vaccine is safe and effective to prevent COVID-19. They reported that the potential benefits of the J&J vaccine far outweighed the potential risk. A warning has been added to the use of the vaccine. So women younger than 50 should be aware of the risk of blood clots and low platelets after administration of the J&J vaccine and of the availability of other COVID-19 vaccines. So 8 million people had the J&J vaccine for COVID-19. 15 of those 8 million were women ages 18 to 59 who developed blood clots and low platelets. 3 of those women died and the others are recovering. The incidence of this condition is very low, 15 out of 8 million. However, the pause was done out of an abundance of caution, as you've heard, and loyalty to safety of the vaccines. Now, early recognition and treatment are key for those who develop the condition, and the symptoms include severe headache with blurred vision or seizures, chest pain or shortness of breath, abdominal pain, leg pain or swelling, back pain, a rash, little red spots that we call petechiae on the skin, or bruising that occurs more easily than you would expect. These symptoms usually develop within a couple of weeks after administration. Patients who develop the symptoms are urged to get medical evaluation promptly and let the doctor know that they had the J&J vaccine. This is not the same as the blood clots that we've heard of in the past. It's different. It's not associated with estrogen or birth control pills or hormone therapy. But the treatment is different. And now that we understand the syndrome, we know how to treat it. So the information about having had the J&J vaccine is very important. The messenger RNA vaccines remain readily available, and it's strongly recommended that vaccination continue. We have seen a significant drop in our numbers since January, the number of cases, the number of deaths, although they still continue to rise, it's much more stable than it was. So we need to continue to try to reach herd immunity. The blood clots and low platelets noted with the J&J vaccine have not been reported with the Pfizer and Moderna vaccines, even though we've given much more of those vaccines than the J&J vaccine. Talk to your healthcare provider if you have concerns about the vaccines. Now, Lake Providence will be a site for a drive-through Pfizer vaccination by Meharry on Friday, April 30th in the morning. The link for registration is meharryvaccination.86borders.com. meharryvaccination.86borders.com. This will be the Pfizer vaccine. It can also be found on the LPMBC Nashville Health Facebook page. Let's remember each other in prayer as we continue to go through this pandemic. Remain vigilant. Continue to wear your mask, wash your hands, and watch your distance. And as always, stay safe, stay healthy, and stay prayed up.